Okay, the recording has started.
Perfect. Thank you. So good afternoon, everybody. Thank you for being here. I'm Lisa Emerson. For the record, I'm Lisa Emerson, Senior Policy Advisor with the Division of Financial Regulation, part of DCBS, and I am the lead advisor for facilitating this rulemaking for House Bill 3243, which is the ground ambulance balance billing law. And we are having our fourth RAC meeting today. It is being recorded for future reference. And so thank you for being here. We'll forgo introductions because we have a lot of people participating and we've met several times now. But when I'll go over some meeting etiquette that we typically do. Just want to remind folks that would you please mute your audio when you're not speaking. It helps with the reduced background noise and distraction. And then please use the raise your hand feature in the Teams meeting to flag that you want to be called upon. And I'll call on people as best I can in order as the hands are raised. And when you do speak, just please introduce yourself, your name, and the organization that you're with, so we have that on the record. And the discussion at the beginning of the meeting will be limited to official RAC members, as well as DFR staff as needed. But there will be opportunity for public comment and a more open discussion later on the agenda, as you can see, and as we typically do. So we will start out with going over the comment deadline after the third RAC meeting that we had in October was last Friday. And as you're aware, probably where we received 2 comments, written comments. And this is the time that we like to give an opportunity for the comment submitters to just speak to their comments, their written comments, and highlight anything that they think is important. Those comments are posted on the Rules of Making Advisory Committee webpage dedicated to this ground ambulance law and this rulemaking. And you also received a copy when Karen sent out the materials on Monday. So let's start with that, and I'll invite, in this order, Sabrina Riggs, representing the Oregon State Ambulance Association, to talk about her comments first, and then we'll go to Tim Dooley with the Association of Oregon Counties after. So please go ahead, Sabrina, when you're ready.
Hey everybody, Sabrina Riggs with the State Ambulance Association. I think the main thing I wanted to highlight from our comments today is, we did discuss we had concerns with freezing the 325% Medicare rate to a certain point in time. We didn't strongly don't feel that that was legislative intent. However, we do understand that there are concerns with DCBS delegating state authority and that language may be needed, tying to a certain period of time may be needed to address that delegation concern. So we did find some, I guess, a similar issue. Home health reimbursement rates for Medicaid are also tied to a percentage of Medicare. Obviously, OHA would have run into a similar issue with the delegation, and they did add in some language to their rules that talk about what the Medicaid reimbursement rate for the home health services are. It ties it to that percentage of Medicare and also says that the agency will be annually setting the rate. So there's like a, I guess, acknowledgement that there's going to be regular rate reset as Medicare adjusts over time. So I think we would recommend language like that be added into these rules. And then other things that were addressed in our comments have already been addressed a couple of times at previous RAC meetings. So I can save off from commenting on that for now.
All right, thank you. And next up, if Tim, you have the floor if you're ready.
I am. Thank you. Not much different than what Sabrina had said. Our one outstanding concern with the draft rule was mostly in that freezing the status quo met 325% as of the January 1, 2026. So we would also appreciate if the department could look at mirroring that OHA language to conduct an annual review of that to ensure that the GASOs are able to still peg to a current rate, because those rates are under the cost that they incur currently, and freezing at that rate for a longer period of time will just exacerbate that problem. So that's really all we had.
Great, thank you, Tim. Appreciate it. So what we're going to do next is go ahead and start discussing the draft rule, the latest version of the draft rule. But before we jump into it, I want to kind of queue up the discussion and preface that the draft rule copy that we sent out on Monday has been slightly modified, and the reasons for that that we're going to provide you with an updated version today for our discussion. The only modifications that were made were a good practice that I overlooked was highlighting in yellow on the red line document the significant changes that we have made since the last time we got together and discussed the draft rule, or the last version of the draft rule that was discussed in October. I thought that would be helpful to, having you not have to look at all the little different formatting issues that or parts that we've already discussed and we've all agreed we're good with. Also, because the comment period deadline was last Friday and we had the Veterans Day holiday and some other scheduling issues to work around within our DFR team, we really didn't have a chance to fully discuss the recently received comments and revisit other comments of all the comments we received until really yesterday and today. And we did decide to propose an adjustment to one of the rules in an effort to try to address an outstanding comment and issue. And just a reminder, if you could please mute your phones when your audio when you're not talking, that'd be great. Thank you. Okay, so just, I wanted to preface that, and we will make sure that, if a copy gets out to you right after the RAC meeting, and that way you have the latest version of what we've discussed to also offer written comment on. So we'll start with the first section of the rule, and I basically just added an R1 that it's a revision number 1 to this set of draft rules that we had sent out on Monday. And the highlights, again, are the things that have changed since the last version of the rule in October, and that's on our RAC website. So really the main thing that's been changed in this first 2 rules of purpose and statutory authority and definitions are we've identified the actual organ administrative rule that we will be using. So the X's have been removed and the numbers have been assigned. So I made changes in this section of rule, although I missed that highlight in the first paragraph, that I, again, put in the rule number, the range of the rules here that we're using for this rule set, and remove the X's. So that's the main change here for the first rule on purpose and statutory authority. And then moving on to definitions, same thing. We've assigned a rule number, made sure we have identified the rule range that these definitions apply to. So that's the key change there. And we can go ahead and scroll down to the beginning of this next section here. The other, I didn't highlight anything else in the definitions of it because there were some formatting issues that'll all be cleaned up when the rules are filed with the Secretary of State. But those are just some minor indentations and formatting issues. For this next rule that's been identified with OAR 836-053-0451. Now, this has to do with the balance billing prohibition and consumer cost sharing for ground ambulance services. Again, the main change here is making sure that I'm identifying the rule that we will get to down below that is referred to for calculating the allowed amount for reimbursement. So I highlighted that number appropriately. We had already discussed in sub 2, all these other things have already been discussed in little b, but in sub 2, paragraph 2, we did discuss the I'll call it as there's been deliberation and compromise between the RAC members, we landed on a 45 business days as the date time frame that inappropriate charges, which we think should be minimal to none, that a ground ambulance service may have administered, they would need to reimburse within the 45 business days. So that is, again, something that has just been arrived at through our 4 RAC meetings and come to a compromise. And I'm happy to open the floor for comments and questions on this change. And we'll start with Charlie with Osberg. Please go ahead.
Hi, thanks. I think 2 things. So, I mean, first of all, I think I would just reiterate our objection to consumers having to wait 2 calendar months before getting getting reimbursed for an illegal charge. So moving away from 30 is something that we don't think is a good idea. That being said, I think, a concern I think about this is that I'm understanding that small rural governments may have challenges meeting an appropriate amount of time to meet this deadline. And what I'm concerned about, though, is if we set the standard at 45 days for everyone, then, as is the case in many other places, the deadline is basically how long everyone's going to take to do something. And so, large, well-resourced companies in more urban settings that could probably cut a check in a day are going to have no reason to do so unless they are required to do so. So I guess I'm wondering if there's a compromise that can be discussed about kind of creating a special set of circumstances where there are very good reasons why maybe it would cost extra money to taxpayers for an additional county commission meeting or city council meeting that doesn't then basically set the standard that 2 calendar months is the amount of time that everyone in the state, regardless of resources, is having to wait before they get reimbursed for, once again, a charge that is illegal under this new law. So I would just maybe throw that out there to see if there's any, just what the response is to that.
Thank you for that comment, Charlie, and I appreciate your concern for consumers. And I am interested in, again, opening the floor to anybody who would like to respond to that. I would say that the practice of our agency and division is, a key part is protecting consumers. And if we were to see an issue, as this law is implemented and rules are becoming into effect, it is something that we would monitor very closely and then try to attend to any issues that would arise. So I just want to put that out there. That is kind of a standard for the agency to do that in practice. So anybody want to comment in response to Charlie's suggestion or comment? And you don't, not to put you on the spot, but you certainly can do it. And you can also follow up with a written comment. Please go ahead, Sabrina.
Thanks. I guess sorry, I think I just accidentally raised my hand again. I guess my thought initially, and I'd have to think more about it, is that seems like it's adding a layer of complexity to the rule that is likely not necessary, because in all likelihood, these circumstances are going to be rare, especially as DCBS fills out their database and lists of which plans are participating and not. And, with these resources, I think that the times when a patient would be mistakenly billed would be exceedingly rare. And I think all of our members would always try to remedy that as quickly as possible. But the 45-day compromise here, I think, strikes the right balance. And if it turns out to be a larger issue later on, then it may be addressed then. But with DCBS's resources, I'm not anticipating that.
Okay, thank you. Thank you, Sabrina. Sorry, I've got different screens that I'm having to take a moment to look at, so thank you for your patience. I'll be right back with you in one moment. And Sabrina, your hand is still raised. Are you okay, or you have more to say?
I'm trying to lower it. I can't figure it
Okay.
out. I'm sorry.
That's okay. All right. Let's keep moving along here. So in the subparagraph 3, again, just flagging that we are making sure to refer to the correct rule number that has to do with the self-funded plans and PEB or OEB, should they elect to participate in the provisions of the law. So I noted that correctly. And then for this next rule, this is getting into a rule about payments to ground ambulance service organizations. And we've identified the organ administrative rule number for this rule set, or for this rule in particular. And considering the comments that we received, we have, considered the question and the issue that both Sabrina and Tim, on behalf of their organizations, discussed about the issue with the Medicare rate and the challenges around that interpretation of whether that rate isn't a rate set in time or how it could change over time as CMS makes updates to their fee schedule. And so we are proposing some language. We looked at the Oregon Health Authority's example that you provided and looked and considered some others, but we think we've come up with another potential solution that we feel good about and want to share that with you. So before we go to that one, let me get to my notes. Let's see. Okay, if you could scroll down to 1B, a little further. So this is something new. This is really the only new thing that really has been done to the rule set that you received on Monday. But this is some language that we've discussed internally. We finally had some time to wrap our heads around this a little bit more. And we have considered all the public comments received so far, additional research and some internal discussion. And the division is in agreement that we think a reasonable interpretation of House Bill 3243's provisions about 325% of the Medicare rate being the default payment rate to a GASO with no established local rate, that the Medicare rate is meant to change over time. While there's no, specific discretion in the law is silent on timing for Medicare rates. Let's see, our interpretation of the law at this time is that the Medicare rate is not intended to be static. So the updated proposed draft rule language is adding that the department is keeping it the same as far as in situations when there is no established local rate, that the payment can be no less than 325% of the Medicare rate as published by CMS as of January 1, 2026, and then thereafter as published by the department in an annual bulletin that we can issue, and we would make available on the DFR website, or if we have a successor, that's just some language that we need to put in there. The bulletin would notify health plans of annual adjustments to the Medicare rate, if there are any, as published by CMS, and the annual adjustment would be effective on January 1 of each year, which is what's typically done when Medicare publishes their physician fee schedule or their fee schedule. And as they just recently did at the end of October, with those rates to be effective on January 1st. So we feel like this might be a potential solution. I'm very interested in reactions to those comments. And we also added this to the other section that involves mutual transport. If you want to scroll down a little bit, Karen, just the identical language is here. So these are the two key changes that were made. Open to, immediate reactions, of course. And then if there are any additional thoughts, time that you need to think about it, vet this issue within your organizations, then you can certainly comment during the comment period. So let's start with Sabrina. Her hand up first.
Hi, Sabrina Riggs at the Ambulance Association. I think this is a really good solution. I think this is a cleaner approach than what we had suggested originally. And we like this language.
Lisa, you're on mute.
I'm telling him he's muted, but I'm muted. So let's go next to Scott.
Hi, Lisa. Scott White from Moda Health. So if, in talking to our subject matter experts on this, it looks like the CMS rates have quarterly updates. That doesn't mean everything changes, but they publish quarterly. So is the expectation that you're only looking at Q4 when you do your January 1 reevaluation here? And if it's a quarterly updates, would it make more sense to say CMS as of January 1st, 2026, and therefore as published after by CMS? Just want to see how, if that's a concern. We might need some more time to think about it, but if it's updated quarterly, you only do one, you're really only looking at the fourth quarter update, seemingly, to make January 1 changes at the department level.
We'll need to do some more thinking about that probably. And I'm interested to hear from other, like the ambulance organizations that are involved in like those cycles of billing too. But thank you for raising that point. That's an important thing for us to think about. I thought it was more of an annual process, but let's go to Antoinette.
Yeah, to add to what Scott's saying, also in speaking with our subject matter experts, the rates may be adjusted, but then it is not published out until a later time. So we need to be able to rely on what is published and not to have to go retro. So that is the operational difficulty here. And I should say that, I've really learned a lot here at the RAC in collaboration with the GASOs. Thank you so much for what happens on your side. And hopefully you learned from what happens on our side to just make sure that, we work together as partners to adhere to the mandate. And to also just make sure that this is operationally efficient for both, the GASOs and also the health payers, because I see this as a partnership. So this is the concern we have. Sabrina, I see your point, but in actually what happens in practice, this is what happens in practice with the CMS and publishing the Medicare rate. So we want to be able to rely on what is published at that time in order to pay if there's not an established local rate. So just wanted to point out that concern. We need to look at practice here. Thank you.
Thank you for that comment. That's helpful. Let's go next to Sean Baird.
Hi, thank you, Lisa. And kind of addressing this, the ambulance inflation factor is always published in very late October or the very early November timeframe as a part of the physician fee schedule updates that CMS does. And I'm happy to get some further documentation of kind of that process from our national association that tracks it, because this is kind of an ongoing every year. It's always benchmarked at that time and published in early November for the January 1 effective date, so that we typically have about 2 months of notice of what that inflation update is going to be, and then they push that all out to the carriers. So I think this can work. You know, maybe there's a word or two that need to be tweaked around, but I do think that the concept makes a lot of sense. And it is only once a year. Even they may update the physician stuff more often, or other providers and suppliers, but the ambulance thing is always only once a year, and it's always in the very late fall publication. So happy to send some additional info over.
Thank you for that clarity, Sean. How does that set with some of you as the insurers now having some of that context? Because that was my understanding from learning. Again, this is a learning process from talking to the GASOs and the representatives. So thoughts on that? Do we need to have something about quarterly, or do you think we could be okay with this January 1 update cycle? And I also received, I receive a lot of different emails, as we all do, from CMS and other different advisory groups about that activity. And so open to more comments, but I'll take back all these comments and we'll talk about it and see if there's more adjustment to the wordsmithing that might need to be done here. But we feel it was a good potential solution to this ongoing issue that's been raised.
Let me raise my hand. This is Antoinette from Cambia Health again.
Yes, go ahead.
You know, I think we just need to simplify this. My concern is that additional language and thereafter as published by the department in an annual bulletin and made available on the division's website. I mean, I'm not quite sure whether that is necessary, given that it is published annually. I mean, we will follow what we get from what is published, you know, by CMS at that time. I just don't want there to be a lag, and not to say the DFR you lag in things, but you know, in terms of having that additional layer of publication, that is just my concern. You know, we just don't want to get don't want to have to wait and there's a delay in getting that bulletin from the DFR as well. I think we can leave it, you know, as it was before and not have that additional language. And its successor too. It's just it's a little bit too much.
Thank you for that comment. We'll discuss it. So thank you for flagging that.
Mm-hmm.
All right. Anybody else? Thoughts? I'm looking for hands. Hopefully I'm not missing anybody. So Karen, let me know. I think we can move on down the line here.
We got Tim. Tim
we
just
got
raised
Tim.
his hand.
Oh, okay. Oh, please go ahead, Tim. That's okay.
I just wanted to say I support this as, again, a cleaner solution for what we had come up with, but also still meeting the goal of the legislative intent. So thank you.
Thank you. Okay, let's scroll down to the next section. Right here is good. Again, for this section. Yes, go ahead.
Yeah, Lisa. So I had a comment on the previous section. If you can go up.
Yeah.
Because, you know, we identified a sort of operational issue here. Keep going all the way up in terms of what allowed amount is. There we go. Payments to Grand Ambulance. Okay. No. Keep one more down, Karen. I think it's a phone section about the payments to Grand Ambulance service providers.
Okay.
Yes.
Payments. Okay.
There we go. So
all right.
That was the section that we were on. So I know we introduced the terms, you know, resident versus non-resident. In here, what's operational difficult is that, I mean, there's really no way for us to know whether the member is a resident or non-resident because, the issue is that we don't have member addresses if they differ from the subscriber. For example, on a group plan where the parent is the subscriber and the dependent is, the member of the plan. The member is like in college in like, it's a college student in like Washington and the subscriber lives in California. And for our large group plans, this is not uncommon. We have that all the time. Everything is built on the subscriber level, where the subscriber is. So with my example is the parent level. So, we if we don't have, if the member's address is different from the subscriber, we are not able to differentiate whether it's a resident or not resident. And it's an operational issue, for us. And the underlying statute does not go into the, does not get very detailed on that level. It doesn't have that term resident and not resident. So just wanted to point out that it is a challenge. So basically, we will just pay, obviously, what is billed, right, by the GASO. Fair enough, for the services they provided. Given this scenario, this is also what Washington does, but it's with respect to the non-participating or those GASOs that are out of network. They have language clarifying what the allowed amount will be, which will be, the lesser of the established local rate or the Grand Ambulance Services Organization's billed charges, which takes care of it. So in either case, we reimburse based on what's billed for the services that billed. So that's the language that we would like inserted. For example, in following a little I, if you can scroll down.
I think I need to scroll back down into that rule.
Yeah.
A little I.
Yeah, keep going down. So right here, before. Ooh.
So that's 1A. I.
Okay, yeah, so we will insert that right before B, that the allowed amount will be the lesser of the established local rate or the Grand Ambulance Service Organization's bill charges.
Okay, we can discuss that. Is there any reaction or any feedback from the GASOs about what the issue that Antoinette is raising? Concern about being able to identify resident, non-resident charges on a bill, because there are locally established rates, I understand, for non-resident, which could differ from the resident, and we'll be collecting that. That's one of the fields of collection for the database. Any reactions to that, or please think about it, and we would like your feedback. So I do see Kendra Harms, please go ahead.
Hi there. I would just wanted, I was going to start typing it out, but it's just so much easier to verbally respond to it. We here in Bend, as well as our surrounding agencies in Central Oregon, commonly have resident versus non-resident rates. And that stems from an ordinance in place that if they reside in the rural fire district that we service, they get a reduction of the rate because they're already paying a fire tax, and that goes towards, in theory, they're paying for certain parts of a fire engine that also goes to medical calls and whatnot. So they get a 50% reduction of the rate. So our rates when we bill are based on where the patient resides, and if they reside within the resident area or if they reside outside the resident area. And when it's a non-resident rate, it's usually a higher charge than if it's a resident in our fire district rate. So the verbiage, if I understand correctly, the lesser of the rate, whether it's the, I'm just trying to explain that the non-resident rate will always be higher than a resident rate. And so if we submit rates at, before by the first of the year that we have resident rate, non-resident rate, there's going to be HCPCS charges with different charge amounts. And so I just want to express that when they have two different rates set by council and they refer to them in those manners. I don't know how that, if I see the dilemma and how to process that for payment at an insurance level, and which rate to know how to pay off of. So I just wanted to express that they're typically non-resident rates are higher than a resident rate. So that's important to understand, I think.
Thank you.
So
Kendra.
Kendra, this
Go ahead.
Yeah.
when there is also a locally established rate, right?
Mm-hmm.
Yeah, so even if there's a locally established rate
Mm-hmm.
and the insurer receives a claim for the GASO for non-resident,
Mm-hmm.
And the claim it's lower than the locally established rate, to us is telling us that even if in that area you specify there's this additional fire tax, you are billing inclusive of this fire tax, okay, for this non-resident. And you are telling us that these are the services we provided, and this is what we're billing you. So in that case, I'm just kind of talking through this. It could be that the bill charges, right, are lower than the locally established rate. And it could be that the bill charges are higher than the locally established rate. So for us, when we get that claim, we will just pay according to what it's, I'm assuming that the GASO would also look at what the locally established rate is and bill accordingly. So we will just pay according to which one, we receive, looking at the local established rate, the lesser of. So, because I'm assuming that it's not going to be where we should expect the bill charges to exceed the locally established rate for non-resident, because it is established. So whatever claim that we get, we're just assuming that it is in accordance to whatever rate is established, whether it's a resident or non-resident. Am I making sense?
Yeah.
Or am I just ranting?
That makes sense to me.
That does make
Okay.
sense. Yeah. We have
Okay.
we have locally established rates for resident and non-resident because our
Right.
full rate to provide the service is the
Exactly.
non-resident rate. It's just they get that reduction at council for an ordinance.
Uh-huh.
They reduce it for residents, but the actual rate study that we have paid, spent thousands of dollars, have somebody establish a rate based on a study, is that non-resident rate. It's just that reduction happens for those residents. So yes,
Okay.
yes, that makes sense.
Okay. Okay. Sorry for ranting on. I was just also talking this through my head. So
That was
thank you.
helpful. Good discussion. Thank you. Okay. So we can go on to the next section that we were at. Sorry, my formatting could be better on this, but the content is there. So for this rule, the rate reporting to the department, there were no changes other than we established an OAR specific number for this. So you can keep scrolling down. And this is where I was just, putting in the rule specifically what was discussed about the rate submission dates that we talked about at the last RAC, that we had some good discussion and back and forth about what date after the initial submission date of January 1, 2026, what would be the recurring annual submission date thereafter. And instead of November, it was agreed that October would be better for all the parties involved, for, the whole process that's involved. So that's the only change that I made here. And any thoughts on this? Please go ahead, Antoinette.
Yeah, hi again. So thanks for making that change to reflect the agreed upon annual October 1st date. And thank you, Gassos, for not having an issue with that date at the last RAC meeting. So with respect to the first portion of that provision, rates must be submitted on or before January 1st, 2026. Obviously, this is for the 2026 calendar year rates. We are already in November. And since we have the Gassos on, and I know that my business team folks are eager to just make sure that we get these rates and we have it in our system. What is the timeline?
It has to do, the time lag here is, it's really not a time lag, it's a readiness issue. There's a lot that has to get accomplished on the information technology and data side, and a lot of progress is being made. We feel like we're in good shape, but as far as the law goes into effect on January 1st, 2026. So on or before, and the Gassos have stated very clearly their willingness to submit rates as soon as we can receive them. So we have that established, but we're still working on getting closer to the survey being more complete to have them start submitting. But I can't speak to a specific date on that. But we're good on this on or before January 1, 2026. And then thereafter, it'll be October 1, and that will mean October 1, 2026. So the fall of 2026 will be an annual rate submission date, and then it'll be October thereafter. So we're not going to just do January 1, 2026 and then wait until October 1, 2027. It will be October 1, 2026. And then for the next annual.
Yeah, for 2027 though, right?
It'll be whatever their rates in effect at that time. We didn't want to, wait longer than that. So, I'm open to any feedback about logistics here, and we're still can keep kind of massaging this issue here. But let's hear from some of the insurers and from the Gassos. And I see first it's Scott's hand up. So Scott White, please go ahead.
Hi, Lisa. Yeah, Scott White, Moda Health. Just to kind of piggyback on what Antoinette's saying here, and just one of our main concerns is that, yes, we have a bill that's effective 1/1/26 that's saying you're paying at locally set rates from a database that is to be set up. And of course, we know the challenges of, getting all those pieces in alignment and making sure it's done correctly. So we certainly appreciate the time the division is taking to do that and taking our comments on the database. And I think you mentioned before some of the technical webinars or trainings that will be available as well. So we really appreciate all that. And I think what I'm trying to be able to relay to our operational teams from a regulatory standpoint is that as of 1/1/26, it's probably somewhat unlikely that we have a full built usable database to check local rates. And so is it seemingly the statute would then, we would fall back to if there is no locally rate set language on how we pay until a local database is available for us to pull from. And so I think it's important for all of us to be on the same page, to avoid complaints and unnecessary issues as we close out this RAC, knowing that there's not a database for us to look at and verify from as we're required to do in statute. And it says if there is, that says a no locally set rate. So I guess we have some semantics on is lack of a database, lack of a locally set rate. So you could argue that, but I don't know how we get that rate without a local database. And so are we just falling back to 325% of Medicare on all these payments until a database is there? That's really important for us to work out here, I think.
Yeah.
I hear you. I hear your concern. And I think we've talked about this in past RACs that that's not the interpretation of the law that we've been going from, that we're some kind of a gatekeeper about paying the appropriate locally established rate. But I can see the operational concern. But how would you be verifying that right now? I mean, to ensure that you're paying the appropriate rate when there is no database before the law goes into effect. So there is a way to obtain or verify the accuracy of what the local, if they have local, if the local government entity has an established rate where they contract with a private entity to deliver those services, that information exists today. So I have a question about that. If you can
Yes,
answer that.
Lisa, to piggyback on your comment about the DFR not being a gatekeeper of the rates, I don't think that is the issue here at all, but you did actually own in on what the issue is, which is the operational aspect of this. And looking at the law, the letter of the law, it says that if there's no locally established rate, the default is that 325%, no less than the 325% of the Medicare rate. So as of January 1st, 2026, and to Scott's point, we all need to come to an agreement on this. If we don't have the locally established rate published, then the default for us is to look at what's published, by CMS with respect to that 325%, as of January 1st, 2026. Because again, we want to make sure that we operationalize and implement it according to the letter of the law. And it's very clear in the law that that is the default. Although there may be a local establishment, we don't know what that is as of January 1st, 2026. So we have to just rely on that default.
Okay, I'm hearing your comment. I'm not necessarily, I can't agree or disagree at the moment. But I hear the concern, and we'll have to talk about it some more. And our goal is to get that information published as soon as possible, as soon as we can. So before I go to you, Scott, I want to go to Sabrina Riggs because she is having technical difficulty with hand raising. So let's go to her, and then we'll go to you.
Sorry, I don't know what my team's problem is today. I'm not
That's okay.
usually the technology problem, so sorry about that. I will just chime in and say, and OSA has shared this with DCBS and in several of our comment letters already, but our members are ready to submit their local rates to DCBS as soon as they're able to accept them. And we've been clear with DCBS and in our comment letters that, our aim is to send those in before the January 1, 2026 date. So that way the database is ready to go on day one. And so we're ready on our end for that.
Thanks for confirming that again. So let's go to Scott.
Hi, Lisa. Just on the question of kind of what you do now. I mean, what we do now is we don't really have a set requirement of an amount to pay. We may pay full bill charges on out-of-network ambulance claims. That's what the importance is here of this sets and tells us what we have to do and what we have to pay. And without, so that just to answer some of that question, and again, there may be some claim intricacies I'm missing. Apologies, I'm not in a claims operation, but it's my understanding that this is what is telling us how to do this. So right now, there's not a set out-of-network ground ambulance payment floor.
Gotcha. Thank you. This is a good conversation, good discussion for us to be having about all the logistics. So let's go next to Sean Baird.
Oh, hi. Thank you, Lisa. I guess I just wanted to comment that, in terms of the discussion about, well, what would the default, if the database itself is not fully functional on the first of the year, I would have a very different interpretation, I think, than I've heard about, well, then what happens? What's the default? Because the number one thing is, do you have a locally established rate? just because it hasn't been entered into a database that may not have been fully built out yet, it is still a locally established rate. It exists. It has it existed before this law was passed. And all the databases is a way of conveying that information. So if it looks like we need a temporary way of conveying that information, I think that the providers, you know, I'm not going to speak for everybody, but I'll speak for a lot of them that I represent with the Metro West group. We would be happy to, you know, indicate in whatever fashion the insurer needed to receive that this is in the rate you're being billed and it's at a locally established rate. Now, obviously, I realize that they may want more verification or whatever, but at some point you're picking a path of how are you going to pay after January 1st if you don't have this verification? And the answer isn't automatically, I'm going to default to the last one on the list, when in fact we do have the first one on the list ready to go. So just a
Thank you.
comment.
I appreciate you sharing that perspective. Thank you. Okay, let's go next to Tim, and then we can go. Well, maybe Tim's hand's down, so I think I'll go back to Antoinette.
Yeah, and Tim, and I think was it Sean that was speaking?
Sean,
I
yeah.
totally agree that we shouldn't just jump to the default if there's a locally established rate, but then it's not published. The concern is that, yeah, there is one, but we, the commercial insurer, do not know, right? So we just need to make sure that we do address that gap, in which I think you just put out a proposal, and I think it's also in line with what the Washington OIC it does. Again, from what my SME tells me, one of the ways that we know that, for example, there's an update to the rates, or that there is a new, established local rate, the Washington OIC pushes out an announcement, to carriers, and would like to see the DFR do the same. That tells us that there's a change in the rates, or there's an update to the rate. So the DFR can do the same in their interim until that database, and even if that database is created, it's not like every day, because it's not every day that we're checking gaso rates and all of that, but they will tell us, push a notice out to us, and there's a way they do that, and let us know that there are new rates or updated rates published, and we know which ones to use. So I think that is a good solution, and also in line with what the Washington OIC currently does. So thank you, both Sean and Tim.
Thank you for the comment. And just to refresh, I think we've talked about it in past RACs, it's probably on the record, but our interpretation has been different than maybe how it's handled in Washington, because Washington has much greater authority. They built their ground ambulance balance billing law into their existing overarching balance billing law. They have a lot more statutory authority in this space than we believe that House Bill 3243 provides DCBS. That's why I use the term a gatekeeper on some level, that I don't believe that the database is whether it's operationalized or not, would allow you to default to the 325% if they have a locally established rate, which is available in the public space, in this public sphere. So let me take all of this back and we'll discuss it again. But that's not been my understanding up to now of how we're interpreting the law. So let's go to Scott, please.
Hi, Lisa. Scott White from MOTA again. I guess I want to clarify, is that a publicly available rate, the locally set rate? And second question, are billed charges aligned with that rate? In other words, and that sounds like a trap, and I don't mean it that way. I'm just trying to understand simple ways to do this to make sure the payments are correct. If
Okay.
are billed charges typically the locally set rate? Because I'm not aware of a published locally set rate that is easily comparable and accessible. I know that doesn't change. I'm not arguing that changes the language of the law, but I'm
Yeah.
just asking from an operational standpoint. Would love GISO input on those questions.
Yes, and I welcome that too. We've had conversations about it, but I haven't gone out and done my deep dive and research on the different publicly available websites. But I would love to kind of hear from any of the GASOs that want to share information about where their locally established rate information can be obtained. It's probably on the city websites or the county websites. I don't know. And so Kendra just posted a comment in response to your question, Scott. Maybe that is helpful. And then I saw a hand go up and then I think I saw it maybe go down. Let's see. So,
Tim,
Yeah,
go ahead.
just to chime in. Yeah, I agree with Kendra. For most of these, they're posted as part of our fee schedule for the fire district or city.
All right, thank you very much.
But
for that
I do
feedback.
sympathize for the operationalization of this for the initial part.
Yeah, definitely. It's a challenge. And so, yeah, I can't make promises, but we're working really hard to make this database happen and be helpful to everybody involved. So, okay. Let's see, how are we doing on time? We'll get 2:30, we've got till 3. We're almost done here. I think the only other change to this self-funded rule and the PEB and OEB, if they choose to participate, if they elect to participate, is add the actual rule number and remove the X's. And we will, I think I've mentioned this already in past RACs, so it's on the record that we are modeling and following the Washington methodology of having the attestation and a dedicated web page for the purposes of the self-funded plans and PEB or OEB to opt in if they choose to publicly on the web. And we would, record names of the plans that are participating to help insurers and ground ambulance providers. So that's all that's changed here in the rule, is just identifying the number. And this is our rule set, our draft rule set. I do have a couple more things to talk about before we go to the public comment period. And I think it's important that we talk about this. I think I mentioned it in the last RAC meeting that we are in a position in timing wise as we get to the end of the year and the amount of time that we need to properly file a rule. We are needing to file a temporary rule. And the reason for that is that we need to file the temporary rules so that they can be in effect on January 26th when HB 3243 becomes law. And filing the temporary rules is really going to help avoid the potential confusion and inconsistency for regulated entities and for consumers. And that's a lot of like what we've been talking about today, or we know about some of those challenges. So we think it's very important that we have these temporary rules, but we will have an opportunity to get back together in January. We probably won't, unless there's an urgent need for us to meet in December. We're planning to meet in January to have a RAC meeting. So bringing this RAC back together for the purposes of a permanent rulemaking. But we'll have a RAC meeting, and in that time, we can discuss the statement of need of fiscal impact. Even though I've shared that with you, you're familiar with it. Be thinking about some of those questions that are in that, we call it the SNFI, so that we can properly consider that feedback for when we are completing that document. Also, we do expect that the language, the draft language that we've discussed today, or what we would be putting in a temporary rule, will be identical to what we present as a final proposed rule. Well before the expiration of the temporary rule timeline, which is 180 days. So just as a kind of a queuing up the timeline here, we would have the RAC. We're kind of placeholdering a date on January 22nd in the new year to have a RAC, and then we would take short session off because everybody is busy with that. And then we would have we'd file the notice of proposed rulemaking in March of 2026 after the session ends, anticipate a public hearing for April, and we would do a permanent rule to have that in place by June 1, 2026. But the RAC will give us an opportunity, to continue to consider comments and clear up any potentially outstanding issues, which we hope there won't be many, if any. But I wanted to, put that on the record for this group, so that's what we're planning to do. And I think now might be a good time to open it up for any public comment from those that aren't RAC members on any of these matters, the draft rules or anything else that you would like to speak to. And just to answer your question, Sabrina, yeah, it'd be 1:30 to 3, the same time period on January 22nd. And that's a tentative date, so just want to put that out there. Go ahead, Antoinette.
Yeah, I was wondering, is there another deadline for additional comments on this draft?
Yes, there is. It's kind of unavoidable, but out of respect for the Thanksgiving holiday, I'm hoping that it could be Friday, the day after Thanksgiving, close of business, or I could even consider the Monday following the Thanksgiving weekend at close of business, if that would be helpful to this group and to commenters. So Monday is, should have that queued up here.
December 1.
Yeah, with that, I think
Yeah.
that would be fine. That would still help us with
Great.
our temporary filing timeline.
Yes.
Yeah. So December 1st, let's have that be the deadline at the end of day to please have any written comment that you may have after this on this set of draft
you.
rules. And I'll send the copy out to you as soon as we're done with the RAC. We'll get that out to you, the one that we've discussed today.
Thanks.
Okay. And then just circling back, I want to put it out there again. If there's anybody who hasn't been able to comment or speak, share their thoughts, I want to offer that opportunity one more time to y'all. Okay, seeing no hands or hearing none, I once again, as always, thank you so much for all the collaboration and the great discussion. And we've accomplished a lot, and your participation and time is valuable to us. So thank you. And I'll keep in touch with you, and I hope you have a good rest of your day.
Thank you.
Thank you, Lisa.
Thanks a lot.
Thank you.